Good morning to you, good morning to Abdiel and to all people who are up and watching this as children and going to school. Good morning to all those who join us to follow our briefing daily. Thank you very much. Today is another day of favorable results. We do not have any deceased, only one case confirmed. In our hospitals, 101 patients remain admitted, 6 in surveillance, 56 are suspects, and 39 confirmed cases, the lowest figure we have had in active cases in more than a month. In our primary healthcare system, our professionals and specialists follow 85 people. Yesterday, the island studied 2,246 samples in the different laboratories of molecular biology of our country. In the brother Ameijeira's hospital laboratory, they worked very hard and they processed 674 samples. In the CIGB as well, with 311. And in the Pedro Curie Tropical Medicine Institute, 303 samples because of a difficulty they had with one of their equipment. And in the provincial centers of hygiene and epidemiology from Havana, 334, and in Santiago de Cuba, 282, in Villa Claras, 191, and at the Civil Defense Laboratory, 151 samples. As a result of the study of these samples, 2,246 samples, one patient tested positive for COVID-19. And Cuba has already studied 170,791 samples studied through real-time PCRs in our country, out of which 2,341 people have tested positive for COVID-19. We always mention that samples are studied from all provinces, although the largest number of samples studied were from Havana with 1,560. But we can add that from Mayabeque, which, as you know, has an outbreak under study. 134 samples were processed, and Matanzas 40 samples, 59 from Ciego de Avila, 58 from Camagüey, 52 from Las Tunas, 48 from Holguín, from Granma 34, from Santiago 92, Guantánamo 59, and so forth from all the territories. And this is one of the goals, and we have the intention to continue increasing the tests in the country and here in Havana, because there is no question, there is no doubt that this is what is going to help find the asymptomatic cases that may exist in our country. The patient diagnosed yesterday is a Cuban who had symptoms at the moment of the admission. He's a confirmed case contact. And with this case, there is a cumulative of 2,032 people, 88.4% of all diagnosed COVID patients who have been confirmed case contacts at the moment of taking the test. And as I always say, this remains the highest risk group. The source of infection has not been determined in 105 patients, and this is the 4.5% of all confirmed patients. And with source of infection out of the country, there are no changes. We continue with 162 people, which represents 7% of all cases. The confirmed case is male for a cumulative of 1,179 people are male, 50.3%. And of the female sex, 1,162, which is the 49.6%. The patient who was diagnosed yesterday was symptomatic at the moment of the diagnosis. Nonetheless, there is a cumulative of 1,265 people, that is 54% in the evolution of the pandemic in Cuba, who have been asymptomatic at the moment of their diagnosis. And if we take a look at the 77 cases that have been diagnosed in the last 15 days, 53 of the last 15 days has been the 68.8% who have been asymptomatic at the moment of the test. And here you have to notice the importance of continue the screening. And as I said at a previous briefing, we have the capacity of processing up to 3 samples daily. Yesterday's case is under 20 years. He's a 70-year-old male from the Cotorro municipality here in Havana. He is related with the outbreak reported in this municipality, which I explained yesterday. So now there is a total of 256 children and adolescents who have tested positive for COVID-19, all of them with a favorable clinical evolution, and 249 of them have been discharged, 97.6%. With this behavior of the positive rate, we can say that Cuba, over the last 15 days, has a positive rate of 0.69 per every 100,000 inhabitants. And Havana remains with the highest rate with 3.37 per 100 inhabitants. Nonetheless, it is lower than yesterday's. Mayabeque, due to the confirmed cases it has had in San Jose de las Lajas, has a rate of 1.3 per 100,000 inhabitants, and Matanzas does not have cases in the last 15 days and is now joining the rest of the provinces that have not reported cases for the last for more than 15 days. And so we now have 13 provinces and the Isle of Youth, a special municipality, without reporting cases of the disease over the last 15 days. And of the 2,341 patients diagnosed with the disease, 39 remain admitted, confirmed. These are the active cases, and as I said, is one of the lowest numbers we have had. And 38 patients, 97.4%, have a favorable clinical evolution. We always regret the death of 86 people who have died in our country due to this disease. This gives Cuba a lethality of 3.67%. And with this rate, Cuba keeps the position of the 19th place in the region of the Americas and the 99th place in the list of countries of the world reporting COVID-19. This is a result of the number of confirmed cases and the fatality rate. We always report the 2 cases that were evacuated, we always mention. There were 3 discharges in the day. There were few, but that corresponds to the number of cases we have had in the last few days, which are decreasing. But nonetheless, it's a positive result because there are 3 discharges and 1 confirmed case yesterday. With these 3 discharges, Cuba already accumulates 2,214 cases who have recovered from the disease, which is 94.7% of people who are back to their normal activities And perhaps there are others who are clinically discharged and still quarantined, waiting for the epidemiological discharge. Today, we report a case in serious condition. It's a 69-year-old female patient from Havana. She is admitted to the Dr. Luis Diaz Soto Military Hospital. She is in serious condition. And today, we are not reporting patients in critical condition. So this is the situation we have in Cuba. And as you can see, favorable results. But nonetheless, we have to be extremely careful due to the risks derived from the behavior of this disease and the way it is spreading in the world. Up to last night, the world remained with the same 185 countries that continue reporting COVID-19. And 160,247 cases were diagnosed yesterday, bringing the total to 10,112,754 confirmed cases, and with 3,043 people who died yesterday, the world has reached 501,562 people who have died as a result of this disease, giving the world a lethality of 4.96%. This is the behavior of the pandemic in the world, and it's not me who is saying this, but the World Health Organization and the Pan American Health Organization have described the situation as very difficult. The region of the Americas already reports 89,982 cases, totaling 5,136,580 confirmed cases, accounting for 50.79% of all cases reported in the world. And with the 1,725 fatalities it had yesterday, the region accumulates 246,508 deaths for a lethality of 4.8% for the region. An image at times may say much more than a number, and that is why I wanted to bring a chart. Today we could say that the US has over 2.5 million of confirmed cases, that it has 125,804 deaths, that Brazil has 1,344,143 confirmed cases, and 57,622 deaths. If we're going to talk about the countries that top the list with the largest number of confirmed cases and deaths in absolute numbers, but I think that an image can be more illustrative, and here we have this chart. Notice that at the bottom you have some other countries. I mean, we cannot see the information pertaining to other countries or to the Western Pacific region, which would correspond to what is the tangerine color. You can see what is related to what pertains to Southeast Asia in blue at the bottom, which is then followed by Europe, which is red. You know that at a given moment it was the epicenter of the pandemic, with countries such as Italy, Spain, France. And then we have the Eastern Mediterranean, which is in purple, but what is really most impressive is the region of the Americas, which you can see there in some yellow. As you can see, it is there where the pandemic reigns. It is the epicenter. And moreover, it has an exponential growth. At this moment, that peak should have been diminishing, but that is not the case, and the numbers grow with each passing day in the region of the Americas. I wanted to bring this in this chart because we can notice that there is not a decrease of cases in America, and I wanted to bring this in these charts because this allows us to know how bad the world is faring, and this could be the message. We cannot deny that some countries have made great efforts and they are trying to curb the pandemic, but it's becoming very difficult because of the behavior of the virus, because of its high contagiousness and the number of asymptomatic cases that are spreading the disease and are not identifiable unless a screening or studies are conducted, and that is what we are doing in our country. I just want to reinforce even more that although the behavior of the pandemic in Cuba is favorable, we cannot hide it. We must feel very proud of this, but we must continue adopting measures because many of these countries have experienced what now is being described as a rebound. And this rebound has a lot to do with not doing the de-escalation properly. The society and the economy are to be reopened, but it is necessary to follow certain rules and restrictions.